Good morning and welcome to Webinar Wednesdays with SMP. We're really happy to have you all here with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs, and I'm going to be your host for this morning. Presenting for us today is going to be Danielle Guillory, who is our Mississippi Community Outreach Specialist and Team Lead, and Brenda Garrett, who is our Community Outreach Specialist in Georgia. And today, for our December installment of Webinar Wednesdays with SMP, we're going to talk about how you can protect your identity from scammers. We're going to be talking about protecting my Medicare. During the presentation, you're welcome to type any questions that you might have into the chat, but we're going to hold those until the end for Q&A. There's also going to be a prize drawing at the end of the presentation today. You must have been registered to attend the webinar prior to 10:15 a.m. this morning in order to be listed, and you have to be present to win. Before we get started with today's presentation, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. So who is Senior Medicare Patrol? Well, if you've never joined us before, SMPs are grant-funded projects, as I said, from the Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own SMP program. In Georgia, Louisiana, Mississippi, and Vermont, SMP is sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Now, before we get started with today's presentations, we do have a quick polling question for you. And today's question is, has anyone ever called you and asked you for your Medicare or Social Security number? So I will go ahead and launch the poll. Yes or no is your answers. If you would, has anyone ever called you and asked for your Medicare or Social Security number? And I'll leave the poll open a little longer so we can give everybody a chance to answer. All right, a few more seconds. All right, we're going to close the poll and share the results. So it looks like 71% of you have said no, that you've never received a phone call like this, but 29% of you have said yes. So now I am going to turn things over to Danielle, who is going to talk about how fraud and scams can occur with these particular numbers. Danielle?
Sorry about that. I was still on mute. Good morning, everyone. So many Medicare recipients have reported receiving calls from scammers that claim to represent Medicare, Social Security, or even a Medicare Advantage plan insurance company. And we get reports of these types of calls on our toll-free hotline and during group outreach. So the caller may claim that there are new Medicare, Social Security, or Medicare plan benefits that are being rolled out. And then some of the callers state that Medicare is sending out a new plastic Medicare card that will work just like a credit card, and they need the beneficiary's information to send out their new cards. Next slide. And so the scam artists may even have limited information about the beneficiary. They may have your name, your address, and sometimes they'll even have your date of birth. And the caller may become extremely aggressive, calling multiple times or threatening that the beneficiary is going to lose some of their benefits or all of their benefits if they don't comply with the request that they're making. And the caller may promise that they can improve the benefits that a beneficiary is receiving or decrease the cost of their insurance. Just remember, they will say anything to obtain your personal information. Next slide. And so, as we said on the previous slide, the scammers sometimes already have limited information, such as the beneficiary's name, their address, and potentially their date of birth. And how do they know so much about us? Well, let's take a look at some of the methods scammers use to steal your information. First of all is hacking and data breaches. So a data breach is something that we keep hearing more and more about. Malicious hackers can target organizations that store large amounts of personal data, like banks, email providers, online retailers, healthcare providers, etc. And once your personal data has been leaked in a data breach, that information can be sold on the dark web. Scammers may also legally get your information through government records. They can get personal data from criminal records, property owner information, and other public records that are freely available. Anyone can legally gather this information on you and sell it to others, including scammers. And this is all 100% legal. Next slide, please. And another way that scammers learn so much about us is from us. We give away reams of personal data if we participate in surveys and contests or fill out product warranty cards on paper or online. All of this data can be sold to others legally or as part of a scam. Selling survey data is big business, and marketing firms and even criminals can learn a lot about us from this information. We also share unbelievable amounts of information on Facebook. Scammers turn to social media posts to learn more about those they've targeted. If you discard or recycle sensitive documents like bank statements, utility bills, without shredding them, you need to beware. Fraudsters can raid your trash to salvage your personal data. You should shred all mail that has your name, address, any account numbers, or other personal data in them. Next, please. Now that we've covered how scammers know so much about us, let's discuss what can happen if scammers steal your Medicare information. Here are just a few examples. You may become a victim of medical identity theft. You might be denied medical services or equipment due to a compromised Medicare number. You may have inaccurate information on your medical records, a false diagnosis, incorrect lab results that could in the future affect your health care. Medicare may be charged for services or equipment that you did not need and never received. You may be financially responsible for medical services or equipment that you did not need or never received. Next, please. So let's take a look at what you can do to help stop Medicare card scams. Do not answer calls from numbers you do not recognize. 99% of us have cell phones with voicemail. Let those calls that you don't recognize go to voicemail. If it is a reliable call, they will leave a voicemail for you. Do not confirm your Medicare number on a call or answer yes to any questions. You need to guard your Medicare card and number like it was a credit card. Don't share your card. Don't laminate it, make copies of it, or let anyone else make a copy. Don't share your Medicare number with anyone who contacts you by telephone, email, or winds up knocking on your door unless you have given them permission to contact you in advance. Remember, Medicare will never contact you for your Medicare number or ask you for other personal information over the phone. And don't let anyone borrow or pay you to use your Medicare number. Next, if you are looking for a new Medicare Advantage plan or you're enrolling in Original Medicare, remember the following. There's no such thing as an early bird discount or limited time offers when it comes to Medicare. Don't let anybody rush you to enroll in a plan by claiming that it's act now for the best deal. Medicare Advantage plans and Medicare are not like buying a used car. Be wary of free gifts, free medical services, discount packages, or any other offers that sound too good to be true. If you don't think of anything else, remember, anything that sounds too good to be true almost always is. Next. Use caution. The Centers for Medicare and Medicaid Services and the Social Security Administration will never call you to update your information or give you a new card. If you receive a call from anyone asking you to verify your Medicare or Social Security information, hang up the phone immediately. If it is a healthcare provider, your doctor's office, they identify themselves as your doctor's office or a hospital, ask them for their name and then look up the number and call them back. Then you will actually know who you're talking to. Do not answer any questions from a caller that you do not know. Next. So now I'm going to turn things over to Brenda. She's going to go over the SMP 3 keys to success for preventing Medicare fraud, errors, and abuse.
Thank you. Good morning. The first key is prevent. Protecting your personal information is your best defense against healthcare fraud and abuse. Share your Medicare number only when necessary, such as at the doctor's office or pharmacy. Only carry your Medicare card when you know you will need to use it. Remember, Medicare will not call you to ask you for your Medicare number for any reason. Keep records of all medical visits and procedures that take place and medical equipment ordered. Next slide, please. The second key is detect. Knowing how to spot suspicious activity can help you stop healthcare fraud and abuse in its tracks. Review your Medicare Summary Notice, MSNs, or Explanation of Benefits, EOBs. Your Medicare Summary Notice is mailed to you by Medicare every 3 months. If you have a Medicare Advantage plan, you will receive an explanation of benefits after you receive healthcare services. Compare your statements to your personal records and look for the following items: medical appointments you did not attend or were double billed for, medical equipment such as braces, catheters, or diabetic supplies you did not order or receive. Next slide, please. The third and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. If you receive a suspicious call, don't give out any personal information. Report the call immediately to SMP. If you have questions about your Medicare statements, call your healthcare provider or plan. If you aren't comfortable calling your provider or you aren't satisfied with their response, call SMP at our 877 hotline number shown on your screen. Next slide, please. You might be wondering how you can help and become involved. Senior Medicare Patrol is always looking for individuals to join our fight against Medicare fraud. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in, give us a call at our toll-free number and we can send a volunteer information packet and answer any questions you might have about the process. Next slide, please. Want to stay up to date on the latest scams impacting older adults in your community? Just scan the QR code using the camera on your cell phone to be guided to our social media platforms using Facebook, Georgia, Louisiana, Mississippi, Vermont, and Spanish Facebook pages, YouTube, and our podcast, Sip and Learn with SMP on Spotify and Apple Podcast. Our state-specific SMP Facebook pages especially are a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us from our community partners. Next slide, please. As mentioned in the previous slides, we have a toll-free number at 877-272-8720. You can call to report potential healthcare fraud or ask us questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. The SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website at www.stopmedicarefraud.org. For more information about the SMP program in your state, our website can be viewed in multiple languages by adjusting the language tab at the top right part of the screen.
All right, thank you, Danielle and Brenda, for that information. Now it's time for our prize drawing. So as I mentioned earlier, everyone who registered to attend prior to 10:15 a.m. this morning has been entered into our prize drawing wheel. So let me pull that up real quick and we'll spin. Let's see. There we go. All right. Danielle, can y'all see the wheel?
No,
Danielle or
we're back
Brenda, I
to,
think you're both muted. Could you unmute and let me know if you're seeing the wheel?
I'm not seeing it. Sunny, can you hear us?
I
Okay.
cannot see it either.
All right. Yes, I can. Thank you. I'm so sorry, you guys. I'm having some technical difficulties over here. Let's see. It's not letting me share the screen. Okay, I do apologize, you guys. I'm seeing it, so I'm going to go ahead and I'm just going to spin the wheel, and I will just name the person that wins. Let's see. All right. Hey, Finley and Miss Joy, I do see I'll reach out to you a little bit later today to make sure I get the information so I can send you your $25 Amazon e-gift card. So congratulations, Miss Joy. All right, so before we wrap up today's presentations, I do want to open it up to question and answer. If you have a question, please raise your hand and unmute your line, and you can ask, or you can type something into the chat if you wish. Let's see. Okay. Well, I'm not seeing any hands raised or any questions coming through the chat. So that is going to conclude our presentation on protecting my Medicare from scammers. You will receive an email after the webinar today with a link to a short survey, and we would appreciate it if you would just take a few moments to complete that survey to let ACL know how we've done this morning. We appreciate you joining again today, and take care, everyone, and happy holidays. And we'll see y'all again next year for Webinar Wednesdays with SMP.